and we've sadly seen more than 51,000 people internationally die from this virus. So every single action we take in this country, difficult and challenging as it is, will be grounded in public health and that simple national objective of saving lives. And let me be very clear, there is no doubt in my mind that the next 7 days are absolutely critical. We have made some progress. We, the Irish people, have made some progress, and we've seen that. And maybe just to give you some indications of where we've seen that. You've heard me talk before about close contacts. We saw about 2 weeks ago, if you were diagnosed with COVID-19, you had been on average in contact with about 20 people. That number then fell to 10, it then fell to 5, and it's now fallen to 3. So we're making it harder for the disease, for the virus, for the germs to spread from one to the other by making sure we come in contact with fewer people, and that's good. We have seen for the first time now figures about people being discharged from our intensive care units. So we don't want people to get that sick that they need intensive care, but it is obviously encouraging that we're seeing some people now discharged, and we'll be monitoring that number very closely. And we've seen the rate of growth of new cases slow, though to be very clear and very blunt, it's still too high if we're to get to where we need to. And just to introduce perhaps one new set of numbers to you today that we're watching very closely and will be monitoring very closely in the department during the course of the week. It's called the RE number, the reproductive rate. And it basically refers to how many other people somebody with COVID-19 infects. So back on the 16th of March, if you were infected with COVID-19, you were likely infecting 4.3 other people. By the end of March, that number had dropped to 2.5 other people. So real progress. People with COVID-19 infecting fewer new people with COVID-19, and that's a good thing. But we need to get that number below 1. Because if we get that number below 1, it means the virus doesn't sustain itself in the community. It means that every person who gets sick is not replacing themselves, if you like, with another person with the virus as well. So that RE number, the rate of infection and passing on the infection, is something to watch very, very closely. As you know, we've taken a number of what I think are swift and decisive actions in terms of trying to slow the spread of this virus. And you've seen many significant announcements in that regard in recent weeks that have imposed the challenges on the Irish people. Now that we've put in place all of those national measures, it's right and proper in terms of any public health response that you would hone in on particular sectors and areas of vulnerability within society, because it's important we leave nobody behind and nobody alone when it comes to fighting this virus. So today we're announcing a range of measures to protect and support those living in nursing homes, to assist their families and their loved ones, and of course to protect those who work in those residential care facilities as well. We now intend to establish both a national and regional COVID-19 infection prevention and control team. We intend to allocate an infection protection advisor to liaise with every nursing home and home care provider in the country. We will ensure equal supply of personal protective equipment to nursing home settings and to home support providers, and also access to oxygen. We also now need to minimise staff movement between residential settings. We need to make sure that we don't have staff moving from one nursing home to the next, maybe with agency. That is a risk to the spread of this virus. We intend to now ensure that our nursing homes undertake active screening of all staff twice a day, and are recommending in our guidance that the temperature is checked of all staff working in residential settings twice a day. And the idea behind this is that if a staff member is feeling in any way unwell or is in any way developing a symptom of a fever, that they can very quickly be identified and obviously go home and take care of themselves as well. Every nursing home now must designate a team, or depending on their size, at least one full-time staff member as their lead contact point for COVID-19 preparedness and response. And every nursing home must produce a COVID-19 preparedness plan, and included in that needs to be a communications plan with residents and with families. We've asked that HIQA would carry out a risk assessment of all residential care settings. And the idea here is basically we know that the regulator knows the nursing home sector really well, and we want them to work in a supportive manner to help provide any additional supports or advice that any of our nursing homes may require. We also intend to provide increased access to training and education for staff with specified skills and action areas. And of course, in doing all of this, we need to recognise that there's a financial cost to the nursing home sector as well. So today we're announcing a temporary COVID-19 financial support scheme. The core concept of this scheme is that the state will provide additional financial assistance to those nursing homes that require it in order to continue to provide their services, and crucially, and this is a crucial point, in order to enhance their services to support the national public health response to COVID-19. There are two components to this scheme. The first is a support payment per month based on the number of residents you have in your nursing home under the Fair Deal scheme. We'll provide €800 per resident per month for the first 40 residents, €400 per resident per month for the next 40 residents, and €200 per resident per month from there on. On top of that, the second part of the scheme will be the opportunity to seek enhanced assistance in the event that your nursing home is actively managing an outbreak of COVID-19. And this scheme is capped at a maximum of €75,000 per month per nursing home. The scheme is in place for the months of April, May and June, and then will be reviewed thereafter. The set of infection prevention and public health measures that I've just gone through with you that are recommended by the National Public Health Emergency Team, along with this new financial support scheme, I do believe provide a framework for a focused and targeted response that is now urgently needed across all our residential facilities. Our primary goal here must be to put as many protective measures in place for those vulnerable within our nursing home settings. I'd like to acknowledge the commitment and the support of the HSE. I spoke to the CEO of the HSE, Paul Reid, on this matter again last night, and I know the HSE is already putting these measures in place and working very closely with the nursing home sector, including being in contact with all those nursing homes with an outbreak. I want to thank Nursing Homes Ireland for the excellent job they're doing in highlighting the issues within nursing homes and working constructively to find solutions with us. And I want to acknowledge the owners and staff of our nursing homes who are working so hard, often in very difficult circumstances. They too are at the front line. They're very much at the front line in caring for some of our most vulnerable citizens. We need to make sure that we protect and mind everybody in our country, and that's exactly what we intend to do, and I hope these measures in place today will help in that regard. I want to also be clear that this is not the end of our discussions with nursing homes, far from it. We'll continue to stay in very close contact with them and to work with them as we navigate our way through this pandemic. I also need to take this opportunity to remind people to stay at home. When we talk about the nursing home sector, we're talking about often older people and people who are very vulnerable and susceptible to this virus. There is an onus on every single person in this country to do everything we humanly can to protect each other, to mind each other, and to particularly protect and mind those older and more vulnerable members of society as well. I finally today just want to acknowledge the huge generosity of Irish people in trying to help our health service at this time. As you know, in recent weeks, we asked people to go to hse.ie/on-call if they felt they could help work in the health service during this period of time. And I'm really pleased that figures I just received today show that there's now another 898 people who are in the process of having their references checked and their Garda vetting and the likes so that they can start working within our health service imminently. That includes 322 more nurses and midwives, 129 doctors, 178 dentists, 193 healthcare assistants, 9 more porters and 16 more people to work in catering. So that's 898 other people volunteering, additional people volunteering to go and work on the front line. And while they're all going to work, the simple thing they're asking the rest of us to do is to stay at home. I'm happy to take some questions. Yeah, so it's quite likely, just as is the same for the general population, it's quite likely we're going to see an increase in cases. We're likely to see an increase in cases in our country in general. And our nursing home sector, and indeed no sector of society, is immune from that reality. I think what is most important to me as Health Minister, and I think most important to every citizen in this country, is that when somebody does get sick, that the appropriate safeguards are in place to mind them, to look after them, to protect them, and crucially to minimise the spread. So it is highly likely that we're going to see more COVID-19 in more nursing homes, absolutely. The key challenge for those working in the nursing homes, the key challenge for us working with them, is to minimise the spread of the virus when it gets into a nursing home. And what I'm hoping today, by these extra measures, the financial measures, but also the extra liaison with public health experts, with infection control specialists, the support of HIQA, is that we can very quickly support the sector take the precautions that it needs to do. And I suppose I do need to make this point. Our staff are doing an incredible, an amazing job. But remember, our nursing home residents are not going out, so they're not bringing the virus in. So we need to be really, really careful when it comes to staff movements, that we're minimising the spread. So that's why we need to do the health checks on our staff twice a day. It's why we need to provide them with personal protective equipment. And it's why we do need to, for this period of time, clamp down on the idea that you could be working in one nursing home today and another nursing home tomorrow and maybe another nursing home the day after. Because these are very vulnerable citizens of ours. They're the generation that helped build our great country. We need to protect them and safeguard them. And we need to make sure that everyone coming in contact with them, even those on the front line providing that care, that we're absolutely minimising the risk of that virus being spread to those older people.
Shouldn't that have been done earlier, especially the agency staff? It seems very obvious that they shouldn't be going into
No, I don't think so. I mean, obviously the government is acting on the public health advice that we receive, and every single piece of public health advice we've received, we've acted on it immediately upon receipt of it. I think the way you generally deal with the public health crisis or a pandemic is you put in place the big measures at a whole population level, and then you very quickly identify further measures that may be needed in a targeted way for further sectors. I wouldn't like the impression to in any way be given that there haven't already been interventions in this sector. Of course, many of the measures we've already put in place have been put in place to protect older people no matter where they live. So asking people to keep their distance, asking people to stay at home, asking people not to visit their mother or their granny on Mother's Day or indeed any other day, discussions we were having here in this room in weeks gone by. The cocooning has meant that things like communal meals and the likes shouldn't have been taking place or probably weren't taking place in the nursing home sector for quite a period of time. So already there's been a raft of measures in place. I think what's very clear now is we need to really double down in that regard and take further measures. And that's what the Chief Medical Officer and his team are doing on a constant basis, constantly watching the development of this virus and responding as quickly as they can. Yeah, that could well happen. So what we're doing here is, in terms of setting up these infection prevention control teams, these are effectively multidisciplinary teams that will be able to help nursing homes and other long-term residential care facilities, particularly those who need it, who might see an outbreak. So nurses, doctors, healthcare assistants and other members of the multidisciplinary team can be deployed into nursing homes. So what we're doing today is not just trying to provide financial assistance for nursing homes, though I accept that's badly needed. This is a sector that's, like everybody involved in healthcare and care in general, has seen increased costs in terms of how they respond to COVID-19. I think the value of what we're providing that's non-monetary is also very significant. The PPE, the oxygen, the prioritising staff in the nursing home sector for testing, and the access to an infection prevention advisor, the support of HIQA, and teams of people that can go in and help as well.
Will the patients be the residents in the nursing homes will also be getting priority testing?
At the moment, we're priority testing our healthcare workers. I think what we have to remember here a little bit, like I was saying a moment ago, it's likely that infection and virus comes into the nursing home rather than actually coming from the residents within the nursing home. And that's why we want to prioritise that first. As you do know, we want to significantly ramp up testing in Ireland. And we want to get to a level where we can do many more tests than we can already do. We're already testing more people per head of population than most countries in the European Union. But we do want to do more. And as we do more, we look at expanding the priority categories to other categories.
Minister, a number of questions, keep it very short. First,
Sure.
what's the approximate cost of this? What's the approximate cost of this nursing home package?
If every nursing home in Ireland claimed the maximum benefit, which will obviously depend on the levels of outbreak, 72 million over 3 months. Yeah, over 3 months.
The nursing home with the 100 cases that Stephen Donnelly referred to, can you tell us anything about that? Is that true, as you're aware?
I don't have any details specifically in relation to that. I'm not in any way suggesting that it's not true. If Deputy Donnelly said it, I'm sure it is. What I rely on is the HBSC's data, which they produce every day in relation to clusters. A cluster is obviously a facility or a home with more than 2 cases. So I don't have any more specific details in relation to that. But what I can say, by way of reassurance to the public, is that the head of the HSE did inform me last night that any nursing home that has a cluster, that has an outbreak, has been contacted now by the HSE. I'm also aware of a number of visits by infection disease specialists in the HSE to nursing homes that are affected to try and assist them. And I'm also aware of additional staffing being provided to some. So there's a lot going on in real time in that regard.
Okay, just one more, if you don't mind.
No problem.
Have you been contacted by medical staff raising concerns over being required by managers to use faulty PPE equipment?
I'm always very nervous to say I have or I haven't, because I get I personally haven't seen any such correspondence. Let me be very clear though, no staff should in any way feel that they need to use any equipment that is faulty. Ireland has done, and the HSE has done, a very good job in securing a supply line of personal protective equipment. I see other jurisdictions across the European Union and beyond actively trying to find a supply line. I think what the CEO of the HSE said last night is that a lot of the PPE that arrived is absolutely usable, that it all meets the approval of the World Health Organization standards, and that it's all quality assured by a team led by Professor Martin Cormacan before it's used. I understand that some of it is different to what we're used to using in Ireland, and I understand some of it may not be suitable. Crucially though, and I suppose this is the good news, we've only received about 10% of it. And my understanding from talking to the HSE is that they're now refining the order for what they're calling batch 2, which is a very large batch worth over €50 million, and they're refining that with the supplier at the moment. We have more personal protective equipment in our country this week than last week. We'll have more next week than this week, and that's the way we want to continue. And I should also make the point that we are using every possible supply chain available to us, and we actually set up a dedicated website this week. If there's any Irish company, any European company, anybody anywhere who believes that they can provide us with PPE, with ventilators, with any equipment we might need, gov.ie/COVID supplies, that goes directly to the Office of Government Procurement, and we will move quickly on that. So the main thing is to have secured a supply chain. Much of what's coming from that supply chain is going to be of great use to us. If some isn't, the HSE need to move quickly, as they are, to refine the next batches of it. But I'd much rather have a supply chain coming than other countries who at the moment can't have one. But no staff should find themselves in that position at all.
Someone said last night that the number who were tested is significantly higher now than the 30,000 figure on Monday. Yet we wouldn't get that figure till early next week. Do you not think that, as is what happens in other European countries, these figures are tested daily?
I do, and I know that the Chief Medical Officer and others share that view. So I mean, I think we're possibly one of the few countries, but whether we are or we aren't, I mean, we make a point of having a daily press conference with our top doctors, with the HSE, with our labs here in this room, for the public to be updated through the media in relation to that. And constantly we're putting out more and more information in relation to testing levels. The figure that I saw, just for what it's worth, is I saw a figure of almost 37,000 tests have now been carried out in Ireland. I'd like to get to a point where we can continue to provide very regular, ideally daily updates. Myself and the Taoiseach have been working with the Department of Health and with the HSE and with the laboratories to receive what we're calling a roadmap next week as to how we further ramp up testing in the coming days and weeks. I'm not going to do what politicians in other jurisdictions do and make kind of political decisions on how many tests we need to do. We're going to take every decision based on what the experts believe we should do and can do. And I think we're going to move to even higher terrain in relation to testing shortly. But I do need to, just as I said to Adam there a moment ago, I mean, when we look at the international comparisons per million population, Ireland is testing way more than our neighbouring jurisdiction, but also way more than most of the European countries. But absolutely, we already have a dashboard that gets updated every night, and we want to populate that with as much information as we can. So we'll see if we can do that. Thanks, everybody. Thank you.